Hello, everyone. In this video, I will give an overview of Chapter 2 of your textbook, Categories of Health Services. So, as you're thinking about having some kind of career in the health field, it's helpful to think through what are the different aspects of providing health services. As I mentioned in my journey last week, I associated health with working in a hospital, dealing with blood and fluids and things like that. But what you'll learn by reading this chapter is that there are different ways to be involved in health that are inside and outside of the hospital. So we'll get started. There are actually 4 broad types of services in health. The first is health promotion. The next is disease prevention. Third is diagnosis and treatment. And the fourth is rehabilitation. And we'll talk through these shortly. So, health promotion. What does that even mean? Health promotion is about reducing the risk of illness, maintaining optimal function, and following healthy lifestyles. It's exactly what it sounds like. We are promoting health. If you think about the definition of health, the World Health Organization says that health is not just the absence of disease, right? But a lot of times we think about the health industry as like treating sick patients and things like that. But health promotion is about promoting health. Some examples of this include prenatal nutrition classes. So how is the mom eating when she's pregnant before she gives birth? Nutrition classes help promote health, right? Adult education programs, nonprofit gyms. These are things that encourage people to live healthy lifestyles. And this is a whole area of health services. And then there's illness prevention services. And this is a little more disease related, right? So this is recognizing that certain folks may have risk factors and targeting those risk factors to prevent a particular illness. So, for example, if you recognize that communities that live near freeways or by refineries are exposed to more pollution, what are ways that we can prevent them from getting asthma or other respiratory diseases? So another example of this would be occupational safety measures. So when you think about occupational safety, and this is different from occupational therapy, occupational safety is the safety in a particular workplace. If you think about factory workers or construction workers where they have different things that they wear in order to prevent injury or illness, that would fall under illness prevention services. And public health education programs. Perhaps you sat in a sex ed presentation about how to prevent getting a sexually transmitted infection or something like that. These are all different examples of how professionals in the health field prevent illnesses. Are there any that you can think of? All right, diagnosis and treatment, our third area of health services. This is typically what folks think of when they think of health. It is the most used service in healthcare. And usually people tend to not be proactive about their health and they wait until they were ill in order to receive medical attention. With the recent advances in technology, as an industry, we are able to diagnose and treat patients a lot better with understanding the human genome a little bit more. We can target our our uh, our approaches and really work with technology to narrow down what is the issue and how can we best treat it. Unfortunately, using more technology can also increase the complexity and the price of healthcare. And our fourth area, rehabilitation. So this is really more about restoration. So if you think about rehabilitating, it's getting it back to what they were before some kind of accident or mental illness or some kind of condition. This could be in a home, in a community center. Frequently, there are different clinics or hospitals that focus on the rehabilitation aspect. And it's generally a long process. When you think about diagnosis and treatment, which was the slide before this, sometimes it can be something quick, like maybe you have a headache and trying to diagnose what that issue is, and boom, your headache is cured. But with rehabilitation, if you've broken a bone or something like that, that'll take a long time to heal. So it definitely requires patience. So what I would like to share with you all is the cliff analogy developed by Dr. Kamara Jones. It's really helpful for understanding the different levels of prevention and intervention. So in the cliff analogy, she imagines there's this town or city that lives by a cliff. People, for some reason, keep falling off the cliff, falling to the ground, and, once they hit the ground, they need some kind of medical care. An ambulance comes through and tries to repair their broken bones or whatever it is that happened there. So that would be medical care and tertiary prevention, similar to diagnosis and treatment. You're trying to keep them from dying after they've hit the ground. The second level, which is above the ambulance, it's that blue dotted line. This is safety net programs and secondary prevention. So if folks were falling off the cliff, maybe instead of letting them fall all the way down to the ground, we'll put a safety net to catch them. So again, this is, if you think about the illness prevention, right? If you're identifying that there are maybe folks who have who are overweight before they get to obese or before they develop diabetes, like trying to get them to trying to prevent that health condition from progressing, right? Trying to prevent them from hitting the ground. But, they're still falling over the cliff. What else could you do to prevent them from even falling off in the first place? And that would be primary prevention, right? That it is those pink colored lines right next to the cliff. That would be creating a fence. Rather than having these folks come through and falling over, rather than having them hit the ground, rather than having them be caught by a net, what if they don't fall in the first place? So that's kind of the health promotion aspect. And then another way of thinking about this as well is how can we address the social determinants of health? So why is there even a community next to this cliff anyways? What if we move them away from this cliff so they can enjoy themselves and not even live in this space that is so dangerous? Dr. Kamara Jones actually extends this a little further as well. So there's different levels of health intervention according to her. So health services, they're along a one-dimensional line. So that's where we saw, okay, you have the ambulance, you have the safety net, and you have the fence. right? That is one-dimensional. You add another dimension when you address social determinants of health. So that is moving the community from right next to the fence, or right next to the cliff, to further away from the cliff. And there's actually a third piece as well, addressing social determinants of equity, which is in a three-dimensional space. So you'll see there's the orange-colored folks and the green-colored folks. You will see the orange-colored folks, not only is there an ambulance and a net and a fence, and they move their community further away from all these dangerous hazards. Not only do they have all these things, but they have also moved away from the fence with the dangerous hazards. But you'll see the green community, they don't have an ambulance, or if they have one, it's in bad condition. Maybe it has flat tires. Maybe it's only around like once a day instead of on demand. There is no safety net, or if there is a safety net, it already has so many people into it that you can't fit anyone else there, or they don't have a fence, or maybe the fence is a shoddy fence and you can kind of still fall through, and they are right there by the edge. And so it's recognizing that there's a sense of inequity, right? That the services that are available are not equal, and there's a sense of injustice. There's a sense of this isn't fair. So if you like that analogy, that was developed by Dr. Kamara Jones. She is an amazing speaker. She was for the previous past president of the American Public Health Association, which is the professional association for public health professionals. She actually has a speaking engagement in September on the 18th, 2017 at 1 p.m. at USC. USC is a bit far, but it is free, and she is doing a talk about how to achieve health equity, tools for a national campaign against racism, right? And so if you look back at this cliff analogy, yes, you can drive the ambulance, or yes, you can build these safety nets, or you can even build these fences as well. You can move communities further away from hazards, but what she's trying to do is address this three-dimensional piece where why is there this green community that is closer to the edge versus the orange community that is generally in a safer neighborhood. So if you want to hear her talk, you can attend this event. The link is on this slide, visionsandvoices.usc.edu/events/listing.php ?event_ID equals 965696. And if you attend, you can get 5 points extra credits. So there's that. Moving forward, kind of thinking through that lens of access to different resources. There are private, let's start to think about what are the different places where you could work, and where are health services being offered. So immediately people think about hospitals, right? But there are differences in the types of hospitals. There are private and public hospitals. Private hospitals are owned and operated by groups like churches, businesses, corporations, and even physician-owned. As a private hospital, they are trying to make a profit for the owners. In order to receive care, patients must have insurance, private funds, or some other type of medical assistance to pay for their care. So if you think about it, a private hospital is a business. You need a way to pay for the services you're receiving. On the other hand, there are public hospitals, which are financed and operated by some kind of government agency, either at the local or national level. So this could be the LA County Hospital, or maybe there's a federal VA hospital. There are nonprofit facilities who admit patients who cannot afford to pay for their own medical care. So what are some critiques of hospitals? They can be seen as inflating the cost of things. They've also been seen to duplicate services unnecessarily. Again, going back to what I mentioned earlier about the technology, that can start to add up in terms of costs. And there's generally a focus on acute services, right? So when people are in need, that's when they're there. Alternatively, there's ambulatory care. And this is more about being outside of a hospital, although sometimes they can be right next to each other, and so it can be kind of confusing. But ambulatory clinics, generally, there's no need to stay overnight. You are not being hospitalized. You're going there for some kind of quick service, and quick can be subjective. And this can be through primary care or some kind of specialty. So either surgery for the day, maybe you're getting chemotherapy. Another aspect of receiving health services that's not like staying in a hospital overnight is freestanding pharmacies, assisted living centers, or hospital outpatient departments. Another area not frequently thought about in terms of the health field are mental health services. So mental health services were actually developed in the 19th century, and it started more as a state hospital. And the purpose was not treating the patient, but more protecting the public from the perceived dangers of what these mentally unstable people could do. They created the National Institution of Mental Health, NIMH, and developed psychopharmaceuticals to be able to treat mental illnesses. So as far as who these folks are, these can be psychiatrists who are medical doctors who make a mental diagnosis, prescribe medications, and may provide psychotherapy. Psychologists who are kind of seen more as counselors but do not prescribe medications. We have clinical social workers, psychiatric nurses who provide management and or psychotherapy. And there are a variety of other mental health personnel as well. Some of the barriers in mental health services, unfortunately, there's still the stigma against mental illness. For some reason, a lot of folks treat physical impairments differently than mental impairments. Unfortunately, 1 out of 4 Americans suffers from a mental illness and substance abuse disorder each year. These are actually leading causes of disability and death, and the long-term treatment is difficult. Unfortunately, most insurance companies have a limited number of days that you can that they will cover for you to be treated in a hospital. And there's actually a relationship between homelessness and the institutional focus that I mentioned before. In our history, they decided to stop institutionalizing the mentally impaired folks. And unfortunately, they didn't have a plan for how to treat them all. Unfortunately, a lot of folks ended up out on the streets, increasing the issue of homelessness. So between 1990 and 2004, the number of inpatient mental health beds decreased by more than a third. And so there were more folks ending up out on the streets in ER units, and unfortunately just still coming in, but in a more critical, urgent manner. Moving on from mental health, there is the U.S. Department of Health and Human Services, which oversees all of this work. It's a public health service and the most important federal agency concerned with health affairs. The responsibilities that U.S. Uh, U.S. Department of Health and Human Services, or HHS, are Medicare and Medicaid, public health, biomedical research, food and drug safety, disease control and prevention, Indian health services, and mental health services. Public health. So, what is this about? Public health, there's a focus on communities rather than on individuals. Additionally, it's focused on prevention rather than treatment of disease. So, again, thinking about building that fence, moving the community away from these dangers. There are 4 goals of public health. The first is to prevent the spread of infectious disease. Second, to protect the public against injuries and environmental threats. Third, promote and encourage preventive health care, including mental health, lifelong healthy behaviors, and recovery. And lastly, preparing for and responding to natural and man-made disasters. So some of these are very visible. Maybe you can think of when there are earthquake drills, or maybe you can think of like when there's outbreaks like Zika or whatever, you can visibly see those things. But other times, in terms of promoting healthy behaviors, those results aren't readily visible. All right, so what can you do in public health? There are commissioned corps, which is a uniformed service where deployment may be necessary. There's also opportunities at public health departments and professional organizations. So throughout the US, whether it's in a city or a county, so Orange County Healthcare Agency for Orange County, or at nonprofits like American Heart Association, all of these places employ public health folks, as well as community nonprofits. At community nonprofits, more likely it's going to be some kind of community health worker, health educator. And those focus on social determinants of health. So these are just a few examples of public health works. So if you've seen the letter grades for restaurants, that's a way of preventing illness, right? Making sure that what you're eating is not necessarily healthy for you, but at least not hazardous to your health immediately. Developing community gardens in a neighborhood to increase access to healthy fruits and vegetables. Some of you may have also seen commercials about the effects of smoking. Those kinds of commercials are an example of public health. And a lot of times folks don't think about how media is related to health, but there's a whole field of health communications and folks trying to create advertisements that don't sell products but promote healthy lifestyles. And believe it or not, at the bottom, there's this woman who's part of the Black Lives Matter protest that you see in this photo, advocating for equity. When you see communities experience higher death rates than others, and not much work is being done about it, that is a public health issue. Police brutality, gun violence, violence overall is a public health issue. So hopefully this helped you learn a little bit more about the different types of health services. So whether it's mental health, diagnosis, rehabilitation, public health, these are all different ways to improve the health of our community, different ways that we can intervene. And the way that we can have a healthier world and healthier communities is not by putting all our focus in one particular area, but we need to work together as a team. And so having this class where you can interact with folks who maybe have a different health profession, then you can still work together and find out how you are improving the health of this community. So with that, thank you.